Well, there's no question there will be reform. There are many questions about who will pay for it and how much. Sonu Wasu continues our live team coverage with some local doctors looking at the bottom line. Sonu?
Well, Michelle, right now the general consensus seems to be confusion. Most people are not sure what this 2,400-page legislation will mean for them, their healthcare policies, or their paychecks.
It's historic legislation. No matter what the impact's going to be, it's probably the most historic legislation since Medicare, Medicaid in the 1960s.
The voting may be over, but the political controversy rages on. The health care bill passed by a tight margin. Now, many are wondering what this means for them. Cedarville University professors Mark Sweeney and Mark Smith are worried about the big picture and the bigger price tag.
I think you're looking at trillions of dollars being added to our national deficit because of this bill. And it's trillions with a T. That's a big number. I think we should assume that whatever price tag we're seeing right now is too small. If you look at estimates, say, for Social Security when it was passed in the 1930s, it looks like they were off by about a factor of 10. So it's been 10 times as expensive as they thought it was going to be.
Mark Sweeney worries this bill may extend coverage to millions of uninsured people, but with overcrowded emergency rooms, how will it affect the quality of health care you are getting today?
Does that mean that wait times are longer? Does that mean that we will have more patients per healthcare professional?
And residents have also been sounding off on my WDTN Facebook page. One viewer writes, "I think those who voted for it have committed political suicide." Another says, "I think history will look back at this as a great thing, not the end of the world." Mark Smith says in the next decade, you might see many insurance companies dropping out of health coverage altogether as it's no longer profitable. He also worries that taxpayers might get discouraged because you really won't see any changes for another 4 to 6 years.
Right now, it's front-loaded with fees, where we'll be paying taxes into the bill, essentially, where we won't really see a payout for quite a while. And so my guess is that's going to weaken even the support that's there right now.
Now, I contacted the local hospitals, and officials at Community Mercy Health Partners tell me right now they are also studying this legislation and trying to figure out what this will mean for them. Live in Springfield, Sonu Wasu, 2 News on your side.